So chapter 2, we're literally going to go into the brain. We're going to talk about the brain in regards to part, load, hemispheres, neurons, neurotransmitters, hormones, glands. All of that today. Okay? You let me finish it all, we finish it. So let's start with the neuron. A neuron is the basic unit of life. So literally when we talk about a neuron is the unit that actually speaks to the entire body. We're going to draw this diagram to understand it a little better. This is a neuron. The neuron has different parts. The middle is called the nucleus. The first arm is called an axon. And then coming from the axon, you have these little kind of fingers, what I will sometimes refer to them, and they're dendrites. And we can kind of look at it here. Okay. One thing. Let me do this at the top. Okay. Inside on this axon, you have what is called the myelin sheath, and the myelin is actually a protective coat. The coat actually protects the myelin from any type of fatty acids or any type of damaging. So when we talk about this axon, the axon is a neuron, so it's firing off nerves at all times. This myelin actually coats it so it won't get damaged. Right? So it's like a fatty substance that coats the myelin, the axon, so that it does not get damaged. Your axons send information. Your dendrites receive information. So to speak to each other, you got a lot of these all over your body because they go and travel up and down the spinal cord. The axons send information from this neuron. The dendrites pick up the information. They send it to the next neuron. So axons send information, dendrites receive information. This is how they speak to each other. Okay? They travel from the brain to the entire body. Whenever the body needs to do anything, it happens through the neuron. Okay? Is everybody still with me? All right. Now, the neuron is actually going to do some communication, and it's done through what is considered action potential. Action potential literally means its ability to fire off. So when the neuron has the ability to communicate, it has this action potential. The aspect of this is either all of it works or none of it works. What's called the all or none effect. All of the neuron works or none of it works. Okay, so your all or none perspective is either all the neuron works or none of it works. All or none. All of it works or none of it works for the neuron. So if the dendrite is broken or doesn't fire off, the whole neuron is dead. Okay. Now, inside or in between all of these neurons, you have what is called synapses gap. The synapses gap is a fluid. All right, so in between all this, you have the synapses gap. Synapses gap is a fluid. Inside of the axon, you have the synapses cleft. The synaptic cleft is inside of the axon. It houses your neurotransmitters. The synapses gap is the fluid. The synapses cleft is housed inside of the axon, and it holds the neurotransmitter. One more time. Synapses gap is the fluid between the neurons. Synapses cleft is inside the axon, and it houses your neurotransmitters. Did I lose anybody? I lost you? Okay, how can I pick you back up? Where I lose you at? Synaptic cleft? Okay, this is kind of like if I broke this axon open, I would see all these little tiny little dots that are called neurotransmitters. I'm going to explain what the neurotransmitters are, but that's inside of the axon. Versus all this fluid here is the synapses gap. So we have synapses and synaptic. We're good? right, now, in regards to these neurons, different type of neurons do different type of things. Your afferent neuron actually speaks to the spinal cord and the brain. Your efferent neuron speaks to the muscle system. So depending on what type of neuron it is, it's going to have a different function. Okay? The afferent with the A is for the brain and the spinal cord. The efferent with the E is for the muscles. The brain can only speak to the body through the neuron. So when the brain needs to tell the body to do something, it goes and sends a neuron to do it. We still good? All right, so we started talking about this neuron. We talked about the resting and the action potential. Action potential is when it actually starts to fire off. Resting potential is this actually happens when the neuron is not responding to anything. There's no signals being sent. Pretty much what it says is resting. Okay, resting potential, it's resting. Action potential, it's actually engaging in activity. Firing is when it sends off the impulse. The neuron is firing when it's actually sending the impulse. Now, when it sends the impulse, the other neuron, the threshold, is literally the strength in which it receives the signal. So the minute that the neuron picks up a signal, it is the threshold. So we have the firing of one neuron. When the other neuron picks up the signal, it is the threshold. It is the strength in which the other neuron communicates and picks up the signal. Just picks up the signal. The minute it picks up that signal, it's the threshold. When it fires off, it sends the message. When it picks it up, it's the threshold. Everybody still following me? All right, good. We talked about the all or none. Now, all or none, we all understand it. After the neuron actually fires off, it goes to what is refractor period. It's the period after the neuron has completed the firing. That's all it is. It's the period after the neuron has completed the firing. It's the period after the neuron has completed the firing. Do you think we need to run through the neuron? Or are you good? We need to run through? Okay, so we're going to do this. What's in the middle of the cell body? What's extending from the neuron? What's at the top end of the axon? Who sends the information? Axon. Who receives the information? Dendrites. What protects the axon? Y'all was on a roll. The myelin sheath. Okay. All right. We good? We still so far? All right. What's in the middle of all of this? Synaptic gap. All right. If I broke this axon open, what will I find? Synaptic cleft. Okay. This neuron is about to send a message to this neuron. That neuron is now doing what? Action potential, so it is firing. This neuron has picked it up, so now this neuron is going to do what? Go into what? Refractor period. This neuron is not picking up anything because the dendrites don't work, so it has the what? All or none. You guys got it. You feel smart for a moment? Hope so, because that was just one page. That was the smallest unit. You now have 5,000 other things you're going to learn in this chapter. But you should feel really smart right now. Okay? You talked about the synapses. Now we're going to break down these neurotransmitters. Inside of this axon, we broke it open. We have this neurotransmitter. Neurotransmitter is a chemical. It's a chemical substance that your body receives in an effort to do different things. A neurotransmitter is a chemical substance your body receives in an effort to do different things. right, so we talked about the exon has sent out a neurotransmitter. Who's going to receive the message? The who? The dendrites. The receptor site is the dendrites. So the dendrites are going to receive the neurotransmitter that was sent out from the exon. Inside of these neurotransmitters, we have two different types of neurons. We have the cause, the idea of firing, and then preventing the firing. So we have the excitatory and we have the inhibitory. The excitatory really means it tells the neuron, send the message. The inhibitory says, stop firing. Okay? It's almost like one says, send it, the other one says, oh, we got it. You can stop now. Does that make sense? Send it, stop. We've got it now. We've received the message. Now, acetylcholine is the first neurotransmitter we're going to talk about. We're going to talk about the different neurotransmitters. ACH is what we call it. These neurotransmitters affect you in so many ways you probably didn't even know it was affecting you. First thing, when your muscles start to contract, that is cause of acetylcholine. If you have paralysis or you have any type of muscle contractions that kind of just contract by themselves, it's because the neuron is sending out messages to actually have your contractions happening. Okay? Memory. ACH also affects your ability to remember. It affects the hippocampus. So this neurotransmitter sends out a message, and we'll talk about the hippocampus in a minute. It sends out a message to the hippocampus that says you need to remember some things. Increase in the chemical level so that you can start to remember. Alzheimer's patients actually have a decrease in their acetylcholine production, which means they don't remember things. The hippocampus is actually destroyed at this time. So the long-term and short-term memory don't link. So their short-term memory does not switch over to long-term. So who's ever met an Alzheimer's patient or knows one? Okay, what you'll notice with them, they can tell you stories from when they were 13, 12, 10, but they can't remember you sitting next to them for the last 2 minutes because the short-term never clicks over to the long-term memory. Okay, it's really because of the hippocampus. Whenever you can't remember things, it might be because your acetylcholine levels are too low. You have to increase the level so you can remember different things. How do we increase the levels? How many of you would like to remember some things more? So what do you do to do this? You think. So when you think, what starts to happen? Do you really? Visualize. Really all it takes for you to increase these levels is for the brain to know it's wanted. Okay, how many of you hate math class? All right. The minute you say you hate math class, guess what the brain does? It hates it. So the minute you walk into math class, guess what starts to happen? Acetylcholine starts to decrease in production. You hate this. I'm not about to sit here and try to remember something you hate. I'm not going to do it. So the brain has to think it wants to increase the production. Now there are some supplements you can take that can do all this, but we want to stay away from added products. All right, dopamine. You might have heard this before. Dopamine is responsible for pleasure, voluntary movement, learning, and memory. Go back to this memory again. Memory and learning link together. If I'm not interested, I will not learn it. But the problem is, because it actually controls voluntary movement, Parkinson's disease, if you ever see a person with Parkinson's disease, you know they start to have involuntary movement. They don't mean to have it. It's literally because of the dopamine levels in their bloodstream. They no longer control that movement. Okay, they no longer control the voluntary part. And then schizophrenia. Schizophrenia actually affects person's memory and learning. We have schizophrenia, which is called catatonic schizophrenia, which will affect voluntary movement. So people get in what is called mutism and plasty, which is where a person actually will stay in one position for a very long time. A person suffering from schizophrenia can actually get a frozen position for about 2 hours and just stay in that position for the entire 2 hours due to some of the dopamine levels. You'll think something is happening and it's just they're in one of those states. Okay, and it's considered a catatonic state. Okay, neuroephedrine, this is one of those things that accelerates heart rate, affects eating, linked activity, learning, and remembering. Let's first talk about how many of you ever been excited or anxious or nervous? What happened to your stomach? Gets in knots. Do you want to eat or do you not want to eat? Some of you don't want to, some of you want to. It's all based on this one neurotransmitter. This neurotransmitter sends out the nervous condition, the stomach starts to lock down, either increases your desire to eat or it makes you not want to eat, all because you are feeling a feeling of anxiousness. Okay? That's how powerful this neurotransmitter is. It also, again, allows you to learn. If you haven't noticed, all these neurotransmitters are very important in your ability to do what? Learn. Okay? And then remember things. Huge. You can't remember, it might be due to some of your levels. Now, the part that is usually a big concern, if I do not produce enough of this, I can actually have a mood disorder or depression because I cannot increase enough neurotransmitters to keep me happy. Okay, so you've met those people who are always sad. They sometimes have to be medicated in an effort to get their neurotransmitters up so that they can actually be happy. Serotonin, you probably have heard this one before. Serotonin is a very important neurotransmitter. It allows you to have emotional arousal and it allows you to go to sleep. We have what are now called SSRI blockers. SSRI blockers are little medications you take that will actually block serotonin levels. If you suffer from ADD or ADHD, you probably take an SSRI. It blocks your serotonin levels because yours are too high. If you drink alcohol, every time you drink alcohol, SSRIs are increased, so your serotonin levels are increased at that time, which is why you have more aggression and more sleep, because you have a higher level of serotonin in your bloodstream at that point in time. People who suffer from eating disorders suffer from serotonin imbalance, which is why they're not hungry, and it sends them into a deep depression. Okay. GABA actually regulates your anxiety. The GABA neurotransmitter represents and regulates your anxiety. Endorphins. Endorphins is your natural painkiller. Okay, endorphins actually get you high. It is as if you are taking morphine. Right? It's your natural body's way of getting you high. So that's a high. Who's ever exercised? Okay, what happens after you finish exercising? What do you feel? You feel good? Tired? What's the feeling? You kind of get that woo, that feeling like I could do this again. You might not be able to do another 20 minutes, but you really feel like you can. Okay, you get off that treadmill like, oh, I could have did 45 more minutes. You probably could not, but because you are on a high, you are on your own body's high. Okay. It also happens during orgasm. Your body releases a large amount of endorphins to get you high off of your own body. This is why people have or suffer from sex addiction, because they're actually addicted to their own body's high. Okay. Also know with endorphins, if you've ever hurt yourself during playing a sport, endorphins can release so high in your body, you will continue playing the sport with a broken leg. You can continue the game. You will not feel it till the game is over because your body has actually created endorphins to take away the pain. Right? That's how strong endorphins can be. Are we good with endorphins? Neurotransmitters. Neurons. You're good because we're about to move on. You have mastered the neuron. Because you know you have an exam this week. $50 questions, 90 minutes, 1 attempt. Which one? Acetylcholine. Acetylcholine is actually a neurotransmitter. When we talk about it, it does a muscle contraction. How many of you ever sat somewhere and you kind of feel like your arm is kind of like doing this, like a jump? Okay, or your leg, you kind of like, ooh, it's like that twitch that's going on. That's because your acetylcholine is actually pouring this neurotransmitter and you're having a muscle contraction. As a woman, you do and deal with this during contractions and regarding your menstrual cycle. You have the contraction. It's actually acetylcholine is actually contracting the uterus. Okay, so it's oftentimes that these are happening at different times, all based on this one neurotransmitter. Involuntary. All right. Good. Because we're now about to move into the nervous system. After the nervous system, we're going to move into the brain, the lobes, the hemispheres, and the parts. So you're good neurons. We can move. All right, let's keep it moving. We now have the nervous system. Now, we just told you the neuron talks to the body. It uses the nervous system to actually communicate. The nervous system is divided into different parts, and we start with the top, which is the master part, which is the CNS, and it combines the brain and the spinal cord. The central nervous system combines the brain and the spinal cord. Now, inside of the central nervous system sends this message, but it can't talk to the body because it has to send all the message to what is called the PNS, the peripheral nervous system. So we've got this brain, we've got the spinal cord, and we've got the peripheral nervous system coming from it. Now, there's a catch about this. The spinal cord is actually the highway. We call it the highway, okay? We call it the highway literally because the brain cannot talk to the body unless it sends a message through the spinal cord. The spinal cord and the body can't talk to the brain unless the message comes back up the spinal cord. So if you want to move your hand, the brain has to send a message through the spinal cord to the hand to move. The hand then has to tell the spinal cord, we move the hand, and send it back to the brain so the brain knows it's been done. If there's any type of blockage in the spinal cord, you have no movement. Does that make sense? So if you have, say you have damage at the lower part of your back, and there's an obstruction there, the brain can send the message down the spinal cord. The minute it hits here, it'll stop and you are paralyzed from the legs down because the brain cannot communicate with the legs due to the spinal cord obstruction. Make sense? All right. Peripheral nervous system is divided into two parts. Peripheral nervous system is divided into the autonomic nervous system and a somatic nervous system. Somatic nervous system are all your voluntary movements. Tell me some voluntary movements. Yes. Give me some more. How about just simply walking? Okay, all those are part of the somatic nervous system. Anything you do voluntarily is your somatic nervous system. Autonomic, what do you think autonomic means? Automatic or involuntary. So this is automatic stuff. What's automatic? Yeah, blinking is one of those that go on both sides. What's another one? Heart. Digestion. Respiration. Breathing. Hope all of y'all are doing this. Autonomic. They're automatic. You don't control these. Somatic nervous system. You actually put in an effort. It's voluntary. Everybody following me? Okay, so what controls everything? Is divided into parts which are called the, what's the central nervous system divided into? Spinal cord and brain. The central nervous system sends the information to the peripheral nervous system divided into two parts called the, which one is automatic? Which one is voluntary? The autonomic system is also then divided into two more parts. The sympathetic nervous system and the parasympathetic nervous system. Who's ever heard of the fight or flight complex? Okay, what happens with this is parasympathetic speeds you up. Sympathetic slows you down. So if I'm thinking that I'm about to get hit by a car, what happens to me? You get that nervous feeling? That's that parasympathetic nervous system. Then when you found out that they hit the brakes in enough time, you kind of calm down. That's the sympathetic nervous system. It calms you back down. It's all autonomic. You have no control over that. So when you start to get nervous, parasympathetic nervous system is getting excited. You have no control. Once you're no longer nervous, sympathetic kicks in and brings you back down. That make sense? Who's ever been nervous before? Okay, what occurs? The jitters. What else? Heart. All these things you do not control. You just start to feel them. That's because this is ranking up and it's kind of going. Who's afraid of giving speeches? All right, just before a speech, what are you feeling? You feel nervous, some of you feel lightheaded, some of you can't breathe, some of your stomach hurting, all of this. Then the speech is finally over. And you do what? Whew. Sympathetic nervous system kicks in and says, relax now, we've done it. It's over. Make sense? All involuntary, all out of your control. So we talked about the sympathetic nervous system and the autonomic nervous system. Maybe you didn't know this. Fear can give you indigestion because it actually brings the nervous system so high that it stops the circulation and the production of acid in your stomach. Sympathetic nervous system, parasympathetic nervous system, we talked about. There's the nervous system. Spinal cord, we discussed. We won't talk about that. And we move to the brain. Are you good with the nervous system? Now let me explain the test, because you've taken the quiz already, right? And how was that? Speechless. It was alright. It was good. What did you think about it? What did you notice? How you sleep? Do you speak? Word it differently. It's the reason why it's worded differently is just not worded from the book. If you notice, it's more scenarios than anything else. So it's not worded differently. It's just challenging what you've already known. So you guys, remember I kept telling you, do not study concepts. Okay? Explain them. Does that make sense? Before you take this test, make sure you can explain the concept, not study the concept. What does that mean? So explain a neuron to me. It's a good start. Explain the parts to me. He's the only one who gonna pass this test. He needs some help. Come on. What else? He got that. All you gotta think like, sound good to me. We're done. That's what you have to kind of do. That's how you study. Okay? Get a partner and actually study that way. Do not get caught in this class where you just read the definition, tell me the definition. Read the definition, tell me the definition, because every test is gonna sound different then. It makes sense? That is the biggest thing people say is like, it's all worded differently. No, it's not worded precisely like the book says. So I always tell people, don't get caught in the book. And look at the book as a resource, not as your primary guide. Does that make sense to everybody? When you use something as a resource, it's like what? It's a crutch. You just go back to it if you need some information. Okay? It's seasoning to your food. It's not the food, it's just some seasoning. See, y'all eating it like it's a main course, and it's not. All right? It's just some seasoning. And this first test is going to bite you a little bit, but you're going to be good. Right? Everybody's going to pass this test. No. I need the brain to recognize we passing this test. So everybody say it with me. We passing this test. Okay, now the brain recognizes we have to pass it. So when you open up the computer, don't be like, oh my God, I'm about to take this. You messed up all of my whole getting the brain to recognize you passing it. So before you start it, you need to look at the computer and say, I will pass this test. The brain will recognize this and it will do better. All right? Often tell people, also don't look at it as a test. For some reason, the brain gets crazy when you hear the word test, exam, quiz. Those words trigger anxiety in the brain. So look at it as assignment, review, whatever you want to call it, do it. All right, so let's get to the brain, which y'all really need to. The first thing we talk about, EEG, we're going to talk about how we read images from the brain. The brain sends off what we call brain waves. These brain waves are very important for us to know functioning in the brain. The EEG allows us to see electrical activity, so we can actually see readings. A person that's hooked up to an EEG machine, things are stuck to the head, and we can actually get a reading. Depending on the levels, we can see if there's high activity or no activity. Okay, that's your EEG. If an EEG has shown us that there are some issues in regards to activity, we can then move to some of the other images that we can use for the brain. First one is the CAT scan or the CT scan. You've probably heard this or seen it on TV or heard a person say, take them to get a CAT scan. It's usually because I've identified something is wrong with the brain. Okay, this image is very vague. It's not going to give you a lot. It might show you that there's bleeding somewhere. It might show you that there's a growth somewhere. It's some additional matter inside the brain. It's just going to be, it's one of the cheaper images that we can get, but it will show us that more investigation needs to occur. Right? So when you first get hit in the head, you go to the hospital, they'll probably say give them a CAT scan first. It's the cheapest, and it'll show us if something has occurred. If we see something has occurred, we can actually move to the next level, which is the PET scan. PET scan actually allows us to see activity in the brain. So we can ask a person to think about throwing a ball. Once we have you thinking about it, certain areas in your brain should light up. If they don't light up, we know there's damage in that region. Does that make sense? Okay, we might say speak. If you're speaking and there's no activity in the brain, we can say this person has now been damaged in this area, so they're not able to speak. And the PET scan will give us that information. And then MRI or functioning MRI gives us a little bit more imaging. It gives us an imaging to where we can actually see if there's an aneurysm somewhere, where it has leaked, is it leaking, has it repaired itself, and any type of other functioning inside the brain in intense imagery. Okay? Now we move to the parts of the brain. Let's start with the hindbrain first. Understand we're going to go sections. I'm going to put sections, and I'm going to put parts inside of the section. You follow me? Sections, then parts inside the section. We're starting out with the first section, which is the hindbrain. Where do you think is located? In the back. It has three parts: the medulla, the pons, and the cerebellum. So you have your pons here. This is showing you the first part. Your pons is responsible for movement, sleep, and arousal. Movement, sleep, and arousal. Your pons, movement, sleep, and arousal. Your medulla is this little device right here. It's responsible for heart rate, blood pressure, and circulation. Heart rate, blood pressure, and circulation. Heart rate, blood pressure, circulation. Your medulla. Heart rate, blood pressure, circulation. Which is this area here. Balance and coordination. We call it the little brain. In regards to keeping you coordinated. Balance and coordination. Cerebellum. The reticular formation. The reticular formation is actually responsible for attention, sleep, and arousal. Now, this is the part I want you guys to understand. In this test, you're going to get scenarios. The scenarios might tell you something has occurred to Susie, has hit her head and is unable to sleep. Which part of the brain is affected? Okay. You have to decide which part of the brain is responsible for this occurring. Okay. Make sure you pay attention if it's saying part of the brain, neurotransmitter in the brain, nervous system, totally different areas in regards to sleep. Okay. Pay attention to the word. Read the entire word. Entire sentence, right? All right. Forebrain. Where do you think it's located? Front head. Forehead, front brain, four parts. Forehead, forebrain, four parts. It's four parts inside of this forebrain. The first one is the thalamus. The thalamus is what we call the message switching system. The thalamus is the message switching system. It takes information from your senses and switches it into information your brain can use. It takes information from your senses and switches it into information that your brain can use. It takes information from your senses and switches it into information that your brain can use. So you smell something. The optic nerve then takes a process called transduction. It sends the information to the thalamus so the thalamus can use it. The brain then says, we just smell flowers. Yes? Good. The hypothalamus, one of the most complex parts of the brain that has a lot of functioning and a lot of duties. First thing, it regulates your body temperature, your motivation, and your emotion. Okay? Then it kind of breaks off to do a lot of things. First one, it regulates your idea of hunger and thirst. Whenever you are hungry, the hypothalamus will send a signal to the body to tell you we need to eat. Whenever you are thirsty, your hypothalamus sends a signal that says we are thirsty. Now there's a problem. They send the exact same signal. Okay? So sometimes you're really thirsty and not hungry. This is why they tell you, drink something. When you get the signal and you think you're hungry, drink something and wait 15 minutes. If the signal is still going off, it means you are actually hungry, not thirsty. But if you eat and you still don't feel satisfied, it's because the hypothalamus has not been satisfied because you were actually only thirsty. Okay? For some reason, the body and the hypothalamus have not communicated very well in understanding how to send different signals. But the problem is it also sends the sexual behavior signal. Okay? If you've ever had an urge, sexual urge, it was your hypothalamus fault. Were you able to control the urge? Some of y'all don't even know if you controlled it or not. Did you control the urge? Y'all scared to say it, huh? You control that part. So you do control behavior, but the urge you cannot control it. If that person you're attracted to comes near you, the urge will come no matter what. You have no control. You can talk yourself down and tell yourself no, 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 no. But the urge is going to constantly be there. The urge will be there until you, guess what? Fulfill it. Now, this is the problem. The urge is there. You're not participating in sex. The urge really says, you better do something then. Okay? So what do you go do? Either you invite you have a moment by yourself. Some of you will eat. Because guess what? Sex is a basic need of life. Food, water, shelter, air, and sex are the basic needs of life. But sex is not always physical. It really means intimacy. Intimacy is a basic need of life. What's the difference between intimacy and sex? Did you know that? Let me rephrase the question. Did you know there's a difference between intimacy and sex? Yes. You can have intimate relationship with some food. Y'all don't know y'all do. Who has a favorite food here? All right, we're going to hypothetically say I put your favorite food in front of you. It's in front of you. You can't eat it. It's just in front of you right now. What do? Show me what you start doing. You start like, woo. What are you doing? You getting all excited. Then you finally get to put it in your mouth. You took the first bite. What do you say? What other time do you? You just had a moment with that food. Some of y'all started doing that little dance, that movement. When my brother be about to eat, he started getting that like, this about to be so good. Okay, and he just gets it. You be like, are you serious? But he is getting excited because it is fulfilling that urge. Does that make sense? How many of you have a pet? Dog, cat? You are literally usually get intimate with your dog. See, people get all like, oh no, I don't. Not on a form of intimacy, bestiality, but you get closer to your dog to where when you rub your dog actually will drop your blood pressure 15 units. So when you are excited and anxious and you don't feel comfortable and you're nervous about something, go get your dog and just rub the dog. His body will actually give you calming feelings without you even knowing it. You also calm him down as well. People who have a pet actually live 5 years longer than people who don't. Oh, jeez. I need to check to see what number makes you have more. Okay? So, when we talk about caring for offspring, what's wrong with that? What's wrong with caring for offspring? What makes that sound really weird? emotions. What else is wrong with that? Does everybody you know who have an offspring care for them? Okay, the reason why the hypothalamus does motivation first. So the hypothalamus ranks what's important. So if sexual behavior is ranked over care of offspring, guess what's going to be ranked as first priority in regards to that hypothalamus? So when the signal goes off, it will not rank the importance of offspring because it's too busy ranking the importance of sexual desire. Does that make sense? And even in regards to food, sometimes people will put their urges and their desires before the tip of the child. You see this a lot with people who are addicted to substances. Okay? And then aggression. Anybody ever take your food away from you? What you feel? Feel a little angry. Okay? And that's because the hypothalamus needs to be satisfied. And until it's satisfied, you'll get a little angry. All right? So your hypothalamus is very important. The next we have your limbic system, which is divided into two parts, your hippocampus and your amygdala. Your amygdala is responsible for emotion, especially anger. You do not control the amygdala at all. You don't control your emotions. You just control what you do with them. But the amygdala is responsible for emotions, especially anger. The hippocampus is responsible for memory. The hippocampus allows short term to be switched to long term. The hippocampus is responsible for memory. It allows short term to be switched to long term. I tell people the best way to know this, on a campus you do what? What do you do on a campus? What are you guys doing right now? Learning. And what does it take to learn? Memory. Hippocampus, you learn on the campus, we learn memory. Hippocampus. Now, marijuana is the first drug that would destroy the hippocampus permanently. Okay? Marijuana will deteriorate the hippocampus to where short term will not move to long term. It is unrepairable. Once it's destroyed, it's gone. Have you ever met the marijuana smoker who's been smoking for a very long time? And how are they? How are they? They high? Well, they might be. They lost? Some of them lost. Yeah, marijuana does not take away your intelligence. Sometimes it stimulates people's intelligence. It does take away your memory. And you'll notice with people who smoke for a very long time, some of the basic things have been lost. And it's because they'll sit and they'll try, and it's just like it becomes not important because it actually takes away the inhibition to where you don't really care if you remember it or not anyway. But unfortunately, it is unrepairable. Once it's destroyed, it's gone. Meth is the other thing that would destroy the hippocampus permanently. All right. These are your parts: hypothalamus, the amygdala, the hippocampus, and the thalamus. Emotions and anger. Mostly anger. This is responsible for thinking and language. Now, when we look at this, everybody has seen a brain before, or a picture of one. What do you got? Worms. It does look like worms. A group of worms. What's in the middle of the worms? Layers. So we've got, this is going to be my brain right here. All right, so kind of lopsided brain. But this is the cerebrium. So this whole thing we're going to talk about is responsible for my ability to think and have language. The surface of it is the cerebral cortex, and in the middle, I have what is called the corpus callosum. The corpus callosum divides the two hemispheres. These hemispheres allow them to speak to each other through the corpus callosum. So if I'm standing here, this is the right hemisphere, this is the left hemisphere. The left side is responsible for the logic, the right side is responsible for the creativity. Right side controls the left side of the body. Left side controls right side of the body. In order for them to communicate to each other, they have to communicate through the corpus callosum. Without the corpus callosum, there's no communication. Still following me? We're good? So we talked about the two hemispheres, left and right hemisphere. We then are going to break these hemispheres down into lobes. We're going to break them into 4 lobes: frontal, parietal, temporal, and occipital. So we're going to move first into the occipital lobe. Occipital lobe is located in the back of the head, and it's responsible for vision. Occipital lobe, the back of the head, responsible for vision. Occipital lobe, the back, responsible for vision. Try to say all 4 of them fast. Occipital, responsible for vision. Temporal, where do you think temporal is probably located? On the side by your temples. It's responsible for hearing, auditory, language comprehension, memory. Hearing, auditory, language comprehension, and memory. Hearing, auditory, language comprehension, and memory. The parietal lobe is located at the top of the head towards the back, top back. It is responsible for your sensory transformation. It takes all of the sensory information and transforms it. Parietal, sensory information, takes sensory information in and transforms it. Frontal, where do you think that's located? In the front. It's responsible for motor cortex, thinking, comprehending, complex movement. Thinking, comprehending, complex movement, and processing. Thinking, comprehending, movement, and processing. Say you forgot something and you're trying to remember. What's the movement you're going to do? How are you going to try to remember? What's the first thing you're going to do? You're going to think about it. What's your gesture? What are you doing as you're trying to think about it? You're probably going to do this. Some of y'all going to do this because the body knows we need to find this information, and the frontal cortex is what's going to find it. The body is trying to stimulate the frontal cortex to find it. You don't even realize it involuntarily that your body realizes where this information is stored. So you start to do this, you start to do this, or you start to look up, almost to like look for it, look for it. Right around the final exam time, it's amazing to watch people like this. And I keep thinking, is it going to fall from the ceiling, this information? Because people are kind of like, look for it, look for it. It's because the frontal lobe in the body recognizes we house information here, and if you want for me to search for it, I've got to do what I got to do, and the body recognizes that this is the movement. Okay? Now, this is called our map strip, or what we call the strip. The strip actually tells us which part of the brain is responsible for the different part of the body. So literally swallowing, tongue, the face, the eyelids, the fingers, the shoulders, the trunk, the hip, the knee, all of this is a strip. If a person undergoes brain surgery, sometimes they will leave the person awake. They will put them in what is called a halo, which will stabilize the head. They'll open up the top of the skull. They can actually touch the brain while the person is still awake, and the person can move their hand, they can lick off their tongue, they can move their feet, they can speak. They don't have to do it voluntarily. All they have to do is stick it with a little needle, and the body will actually respond because you touched that part of the brain. Okay? I mean, I would not say go get it done, but just in case you have to. Now, left and right hemispheres, we just talked about this. Now, in regards to the left and right hemispheres, you also have these areas called the Broca's and the Wernicke's area. The Broca's area allows you to speak. The Wernicke's area allows you to understand language. The Broca's area allows you to speak. The Wernicke's area allows you to understand language. Broca's area allows you to speak. Wernicke's area allows you to understand language. Broca's speak. Wernicke's understand language. They're located in different areas in regards to the hemisphere. The Wernicke's is located in the temporal lobe, which we already understood that the temporal lobe allows us to have language comprehension. If you have an impairment in this, you will not have the ability to understand what you hear. You will have the ability to say words, but you cannot comprehend what you are trying to say. So it kind of sounds like some babbling. Okay? The bronchus area allows you to be able to speak. If you have any type of obstruction or damage to the bronchus area, you can comprehend what a person is saying, but you cannot speak. You are trying your best to talk, but you can't because the bronchus area is damaged. All right. Left hand, right hand, left brain, right brain. When we talk about the hemispheres, we're going to break. We just talked about those moves. Left-handed people know it is a genetic link. You actually have inherited this from some type of genetic pattern. The hemispheres, we've got your right and left hemispheres, is divided and connected by the what? The corpus callosum. Some people who suffer from epilepsy, they have a procedure called split brain research. In split brain research, they actually split the corpus callosum from each other. Remember we talked about the right brain and left brain can only speak to each other through the corpus callosum. In the split brain research, they actually divide it to where the two hemispheres can no longer speak to each other. So what starts to happen is, depending on what I do on my right side, only my left brain can comprehend it. When I'm on my left side, only my right brain can comprehend it, but they don't communicate together. Okay, it actually stops seizures from happening, but the problem is it causes different type of awareness in regards to where you have to search and look at things. So when we look at things, if I put things on this side, after the split brain, only this side will understand what I saw. If I put it on this side, only this side will understand what I saw. Does that make sense? If a person is under 13 when they have the procedure done, the other side will usually compensate for the loss. Over 13, you kind of have to keep moving things back and forth to process the different information. Are you done with that? Got the brain down? Yes? You good with the brain and the brain parts, hemispheres, lobes, parts, section? Bless you. All right, let's move to the endocrine system. We are now talking about hormones. All right? The endocrine system actually releases hormones into the blood. We're going to talk about different type of hormones. The first one we're going to talk about is the pituitary gland. The pituitary gland is the master gland. It is responsible and located in the hypothalamus. So it regulates the hypothalamus. Pituitary gland regulates the hypothalamus regulates the pituitary gland. Hypothalamus regulates the pituitary gland. Remember all those things that the hypothalamus is responsible for? Yes? No? Yes. Sexual urges, hunger, thirst, offspring, emotions. So whenever the hypothalamus responds, it triggers the pituitary gland to release a hormone for that certain type of response. Sexual urge, hypothalamus release pituitary gland, pour in hormone. Hunger, release the urge, pour in hormone. Does that make sense to everybody? Good. All right. Pineal gland is actually responsible for your production of melatonin, which allows you to want to sleep. Oftentimes you hear people take melatonin supplements. They can take supplements because your body already produces the natural substance of melatonin. Melatonin increases your ability to sleep. If you take melatonin, it's supposed to make you want to sleep longer, sleep better, sleep harder, type of thing. Some people work, some people it does not work for. The thyroid gland, you've heard of this gland probably before. It regulates your metabolism. All right. The problem with the thyroid gland, it can either be hypo or hyper. Depending on which one it is, your thyroid gland might work too much or it might not work enough. If it works too much, you always feel like you're working out and you probably have an increased heart rate, which really means your body is always under the idea that it is active and it is actually exercising. You will probably never gain weight because it's constantly using everything you eat to use as energy. You just will constantly use it. You will usually go through some type of radiation treatment to calm your thyroid down because it can actually take you to a point where you feel like you're having a heart attack. Okay, you're usually always tired. If your thyroid is underdeveloped, it does not break down food fast enough. So your body stores everything you eat and you usually will never lose weight. Adrenal gland is with your kidneys. It actually releases the hormone cortisol. You've heard of cortisol before if you've ever seen a weight loss commercial because it is actually the hormone that's released when you're under stress. Okay? It affects your weight gain in your stomach area. Testosterone, I hope you've heard of that before. It is located in the testes. It is a hormone that is produced only by men. Surprisingly, when a man kisses a woman, he actually passes testosterone through his saliva to her. So every time he kisses her, he gives her more and more testosterone in an effort to increase her sexual desire. So the longer he kisses her, the more excited she gets because she does not produce the testosterone, but he can actually manufacture it for her to become excited, and it's given through them through the saliva when they actually start kissing. The estrogen is the thing that the women actually produce, and it is housed based on their ovaries. A woman actually comes to the earth with about 400 to 500,000 ovaries on her day of arrival, which means she has 400 to 500,000 chances to have a baby. She starts to produce these ovaries and kind of releases them all her life until she reaches what is called menopause. At menopause, she now is no longer able to have children because she has ran out of all of her ovaries. She now has a decrease in her estrogen levels because she no longer has the urge to reproduce. Her body and your body is actually designed for the purpose of reproduction. Okay? So what starts to happen is the body recognizes when it's time to reproduce. So when a woman ovulates, it actually sends a signal to the body to produce a hormone and pheromones to attract the opposite sex so that we can actually reproduce. Male actually sends and receives the pheromone that the woman is giving off, and he is now more attracted to her during this time because she is highly able to reproduce at this time, and that's the purpose of her body. Does that make sense? It is all done without you even knowing it. It's just that time that you're more attracted or more attractive to the opposite sex because it's the time you're releasing the hormones to actually have production. One thing you need to know in regards to sex, a woman can never fake an orgasm. The reason why is the hormone is released from the body and actually turns the body another color. She will actually turn color from her feet all the way up to her head. She will turn like a reddish color, pinkish reddish color. She cannot control this. Is why she has the flush color after she reaches the orgasm. If she is being honest, she cannot control the response. She can never fake it. All you gotta do is turn on the light. And you'll know. All right. We now have evolution selection. How many of you are over 25? One. Oh my. Okay. Back in the day. Um, Back in the day when we were in the 8th grade, we looked like 8th graders. And what does an 8th grader look like? Back in the day. Like a kid. You probably couldn't tell the difference between a 6th grader, 8th grader, probably not even a 9th grader, because it just didn't happen to about the 10th grade. Let's fast forward to 2013, 14. What do these 8th graders look like? Big, tall. I went into my nephew's school and I'm like, why these grown men walking these halls? I mean, he had beard, mustache. He was 6'6", and he was like, oh no, that's just little Johnny. First of all, ain't nothing little about Johnny. And Johnny started talking and he's like, hey! I'm like, oh, that's so wrong. It's messed up. But the idea is that we start to mutate as we start to grow. And as you look at the whole idea of Darwin's theory of evolution, we actually mutate in regards to our adapting to our surroundings. We adapt to where we are. If I took you right now and placed you in a whole nother country, you would start to adapt to the surroundings in an effort to survive. So if you have thin hair and I take you to a place that has a very hot climate that the sun is constantly beaming, your hair will start to thicken just so you can protect yourself from the sun rays. It's just something that happens automatically. You adapt to your surroundings. I'm from Michigan. I moved here 4 years ago in November. I live in Michigan. Right now, the weather is negative 17. That's what my mama said it was yesterday. Negative 17. That's cold. Okay? Down here, it might get what? 20 degrees? That might be low. Okay. When I go home, I am freezing. And my mother says it's not that cold because it can get as low as negative 32 degrees at home with about 4 to 5 feet of snow. Not inches, feet. Okay? It takes you a while to shovel the snow out the driveway. So you got 4 to 5 feet of snow, negative 32 degrees. You cold. Come down here, it's 20 degrees. My brothers come here to visit and they're like, this is nice. We can wear a jacket. Everybody else has got some gloves on, hats, scarves, and everything. But now that I've adapted to this weather, when I go home, it feels like it's excruciating, painfully cold because I've adapted to the change. My sister lives in Florida. She said it was 82 yesterday. So she's got 82. My mom has negative 17, and I think we had 26. Okay, so when my sister comes to visit, she was like, "How do you stand it so cold here?" And I'm like, "No, it's not. Like, do you remember what it felt like at home?" But because you start to adapt to your surroundings for survival, you change. Does that make sense? So our girls are starting to look different now. Our boys are looking different now. Part of it is adaptation. Part of it is hormonal influences that we're now putting in a lot of our food. Okay. People are also even looking older now. If you look at some of the girls and the men, they look older than great great grandma did in the pictures that you've seen when she was 12. Okay, because the hormones that they're now consuming. Instinct. Everybody in this room has instinct. It's literally a pattern that you do in a certain situation. Now, how many of you ever been in a car with your mother and she slammed on the brakes? And what did she do? Slammed and hand went out. My mother, I am 40 years old. And when I'm in the car with my mother, she still extends her arm out in an effort to protect me. And every time she does this, I laugh and I say, "What is this arm supposed to do if they hit us?" And she's like, "I'm saving you." No, you're not. You about to break your arm. That's about all you're going to do. But you do it as well. If you're ever around a kid that does something, your instinct is to grab. Okay, I'm going to even show you how your instinct kind of knows the difference. Your instinct has a set pattern. It knows when to do something and when not to do something. If somebody slaps you, what do? Slap him back, right? Is that what your instincts say? Slap, slap back. What happens if your mother slapped you? That instinct kicked in real quick and was like, "No, you don't." Okay. Now, your mama slapped you on this side. As soon as she slapped you, your brother slapped you over here. How fast would you slap your brother back? Probably really quickly. Your mother could slap you, your brother slapped you, you slapped your brother, and you just looked at your mother. It just worked that fast because instinct is that good. Okay. Your instinct also knows when a situation feels uncomfortable. Your instinct sometimes can pick up situations before you mentally process them. It's just something when you stand somewhere, you're like, "Oh, I don't like this. It's something about this place." Your instinct is telling you, we pick up some type of pattern that is uncomfortable. Your mind yet has not processed. Please get out. Okay, that's why people sometimes say, follow your instinct before you follow your processing. Does that make sense? All right. Heredity. A lot of you understand this. You are who you are because of your parents. We started talking about genetics. So your heredity is your genes. It's the genes that have been passed down from generation to generation. Genetics is actually the study of heredity. Okay? Genetics is the study of heredity. When we go into the genes, it's your basic unit of heredity. So your parents have given you a bunch of genes. They're giving you these genes in what are called chromosomes. So I have my father and I have my mother. When my mother and my father decided to get together, they created this zygote. Okay? Male children can only create men children. Women can only create women because we only have X and X chromosomes. Okay, so X and Y create a male, X and X create a female. Women only give off X's. So this, let's just say this sperm was an X, so it created an XX child. If this sperm was a Y chromosome, when they got together, it creates a male child. The male determines the sex of the child. Okay. Now, inside of each chromosome, each parent is giving you 23 chromosomes apiece to create a set of 46. You've got 23 chromosomes from each parent. Inside of these chromosomes are genes. These genes actually create who you are. They create a pattern or set, or what we call them. These sets actually create, if you've got brown hair, black hair, brown eyes, blue eyes, green eyes, yellow eyes, dark skin, light skin, 6 foot, 2 foot, whatever you got going on. Okay? It's the basis of these two parents giving you these things. I often say it's like rolling dice. Your parents, when they got together, it was kind of like they just took all these genes that they got, they rolled them together, and whatever they got came for you. Right? So you really don't know. On the 21st pair, if you have an extra chromosome, you have a Down syndrome child. Okay, all Down syndrome children they look just alike. No matter what their race is, they look exactly alike because they all carry the extra chromosome pair. Because science has become so evolved right now, you can actually pick your genes before you have your child. You can make your child before you have your child. Okay, so you can say I want a child that has black hair, 6 feet tall, um, and whatever else you decide. At that point in time, they're going to find the ovum. Ovums are eggs. Ovum that contains those things. They will find the sperm that your mate has that contains those things, put them together, and create your child. Okay? That's how far science has gotten. It's supposed to only have been used to help with diseases like Down syndrome, sickle cell, and things like that, and it just got a little bit beyond that at the point. Now, when you have these individuals and you have a child that's born, you have what's called a genotype and a phenotype. Your genotype is your natural biological makeup. It's what you're biologically brought with. Your phenotype is your nature incorporated with environment. Genotype, your natural makeup. Phenotype, your nature with environmental influences. Genotype and phenotype. What this means, genotype, you have light, you have blonde hair. Phenotype, you have bright blonde hair because you live in an area that has a higher sun rays. Does that make sense? So you have dark skin, you live in an area that has a lot of sun, you have a darker skin. So your dark skin is your genotype, your darker skin is your phenotype because you have the environment that has influenced your genotype. Does that make sense? Good. We talked about the 23 chromosomes. 23 from father sperm, 23 from egg, creates a set of 46. XX is female, XY is male. Extra chromosome on the 21st pair creates Down syndrome, which is considered a chromosomal abnormality. Down syndrome, all of them look alike. You can see in regards to the structure of the eye and the mouth, they just all have that same structure no matter what. Monozygotic and dizygotic twin studies. Monozygotic means one sperm, one egg created 2 children. They are called identical twins. One egg, one sperm created 2 children. Monozygotic, one egg, one sperm, 2 children. Dizygotic, 2 eggs, 2 sperm, 2 children, fraternal twins. 2 eggs, 2 sperm, 2 children, fraternal twins. Monozygotic twins are always going to be the same sex. Identical twins are always the same sex because the same sperm fertilize the egg. Dizygotic twins can be opposite sex because 2 separate sperm fertilize the egg. And that's chapter 2.